this telehealth visit. We're using Zoom, you know, we're using best practices. I've seen you before, so I don't need to see your ID. Are you comfortable that you know who I am?
All is good.
All right, good. And you're at home, right?
I am at home.
All right, and if I need to catch you, it's still
You got it.
cool. All right, so how are you doing? How's your neck?
I'm good. Continuing to do my exercises. I did warm up this morning, so we'd be ready.
Excellent.
I probably missed 2 days last week. It was the weekend, and I just, at least I wasn't sitting at my computer.
That's right.
I have some soreness between my shoulder blades, but that's because
that's a good thing.
Yeah, that's the normal soreness for working on some muscles that I had been working on. So, so overall, feeling better. Yep.
Okay. So you had, when we first did your initial evaluation, you had a couple of things that you talked about being really difficult for you. So turning your head to the right when you were on your stomach in particular, you said
right.
Turning the head to right. So how is that? Do you sleep in that position?
I'll flip around, but mostly if I'm on my stomach, I usually turn my head the other way. So. Okay.
All right. So how is turning your head to the right now? Oh my goodness, much better.
Much better.
Much better range of motion. How about the pain?
Better. You know, still stiff to some degree, but better for sure. And you know, I told you when we did our first session that I'd had a headache for every day for like 7 days straight.
Right.
And I hadn't had any headaches this week, so that's good news.
Awesome.
That was the best news.
Yeah. And then how about, so when you were talking about turning your head to back up the car, you probably haven't done a lot of car driving, but you'd said that on a scale of 0 to 10, where 0 is really hard and 10 is normal, you'd put that at about a 2. Where would you put it now?
Pain-wise?
Function-wise. So whatever, just your ability to
okay.
it. Yeah.
I'm probably about a 4.
Okay.
4 or 5.
4 or 5. What would make it a 7?
I can't get quite around far enough to see behind me. Better.
How about sleeping comfortably? You labeled that as a 7.
Actually, I'm sleeping better, so I'd give that like a 9.
That's terrific. All right, and then the other one, which was turning your head to the right when you're on your stomach, you gave that a 3.
We give that probably a 5.
Oh, good. All right.
Yeah, and I think the backing up the car piece
Mm-hmm.
is also thoracic rotation, which we've also been working on.
Yeah. So I would love to just kind of run through your SFMA again and just kind of see where things are, and then we can see what we need to do next. All right. Okay. So I think if we can stand up.
Yep. I'm gonna realize with the others, I can raise you up, and that might make things a little better.
Ah, nice. There you go. So your shirt, do you have a tighter fitting shirt?
I did not wear that today.
All right. Okay, so maybe what we can do, can you just take your shirt and maybe tie it so that tie it to the front, so that particularly when I'm looking at your back, I can start to get a sense of how you're rotating. There you go. Remember when you were a teenager?
I did do this.
My daughter does that all the time. She's like, "Oh yeah, Mom." All right, good. So you're right now you're standing with your feet hip width apart. Your hands are down by your side. Yep.
It's
okay for right now, because I'm going to look at your head for right now, your head and neck, and then I'll ask you to change things up. There you go. Good.
Okay.
Yep. Close those feet up just a little bit. There you go. All right. So if you could take your chin to your middle of your right collarbone. Good. And come on up. And middle of your left collarbone. And come on up. How are those?
Better.
Yeah, those look, they're almost normal.
Yeah.
Yay, that's great. All right. Then just while you're here, go ahead and turn your head just straight to the right. Mhm. And straight to the left. That's it. Good. All right. Let's go ahead and turn, quarter turn. Yep, that's fine. Good. And you're going to tuck your chin to your chest. Good. A little bit further down. Try and look down towards your belly button. There you go. Is that painful?
Not really.
Okay. Just, and how about looking up to the ceiling? Good. Come on up. Is that okay?
Yeah.
All right. And then turn to look right at the screen with your head. That's it. Good. That's much better. And you don't have so much of a head tilt. So that's good. All right. Flip around 180 degrees. And yeah, that one's still a little tricky. Left rotation is within normal limits. One more time. And last round. So the good news is I feel like you're not getting as much of a compensatory head tilt, but you definitely still hard to do. Okay, so we need to work on that still. Okay, so now if you can turn around so you're facing your clock. There you go. And yep, your feet are still hip width apart. So a little bit, there you go. And if you can take your right hand, it goes behind your neck and reaches to your left shoulder blade. Good. And come on down. And let's just swing right up into that position one more time, same side. Good. Come on down. Any pain with that?
No.
Good. Switch sides. Good. One more time. Good. And then we're going to come up from behind your back, right?
My shirt didn't want to stay there.
Good. Come back down. Let's do that one more time. Just a nice free swing up. Good. Good. Switch. Oh, that one's much easier, huh?
Yeah.
All right. Standing right there, go ahead and keep your feet planted. And I want you to spiral, rotate around as far as you can to the right.
Just like.
Well, yeah, but keep your hands down by your side. It's okay.
Okay.
Good. Left. Good. One more time each side. Good. I think your thoracic rotation's gotten a whole lot better.
Yeah, it feels better.
Yeah, it does. Good. Okay, and then turn to the side. Which one? Your choice. All right, and you're going to reach down and touch your toes. Good. Come back up. So let's go ahead. That was a bad cue on my part. Don't bend your knees. Just go down as far as you can. Okay. Yeah. So you're going to start top of your head. Oh, come back up. To start at the top of your head, and you're really going to curl down.
Okay.
Yeah, and then you can let your hips go back. And good. Where are your hands relative to the floor?
Yeah, right at the top of my shoe toe.
Okay. That's better. They were mid-shin. It was mid-shin last time.
Yep.
So, all right, and then your hands stacked one on top of each other. You frame your ears. Oops, stay turning sideways though for me. Good.
Okay.
And you're gonna arch back. Okay, come on up. And rest. And we're gonna do the same thing facing the other side, just in case I can see something different.
Can you see my feet, or do you need to see my feet?
I can't see your feet, but it's okay because really what I'm looking at right now is spine and hip function.
Okay. All right. Ready?
1 second. I'm just taking a quick note. Okay, go ahead. Keep those knees straight though. Yeah, start again. There you go. Good. And where do your feet, your hands end up?
Same place.
Good. And stack your hands, frame your ears, good, and arch back. Okay, take a break. Good. All right. All right. Do you have a Theracane?
No.
Okay, that's right. Have a seat.
Okay.
There's a lot that's better. Two things. One, I think that you know, your hip flexors are super tight, right? So when you arch backwards, those hip flexors really kind of get in the way. And I think just in terms of overall taking care of your back, and you have a little bit of low back pain when we started this as well, that I think we want to, given that we're doing full exercise, that we want to make sure we stretch those hip flexors out. So we're going to talk about that. But a lot's improved in your cervical spine, and I think a lot is improved in your rotation, in your thoracic rotation. So I feel much better about that. I want you to keep going with the exercises that we've been doing to warm up thoracic spine and to work on that suboccipital and those muscles, because it's making a difference. But I want to add something in, because I think really it's now not so much cervical spine and thoracic spine, I'm sorry, suboccipital and thoracic that are the limiting factors. Now it truly is that mid-cervical that's preventing that full rotation over your shoulder, okay? So I'm gonna want you to work on trying to kind of do your own joint mobilization.
Okay.
So, so you have an exercise where you're pushing, your elbows are down, you're in your suboccipital, and you're pushing forward as you nod forward, right?
Right.
Okay, you're gonna do that one, okay?
Okay.
And then you're gonna do your neck warm-ups the way we've learned to do those. But then once you've done that, I want you to work on your mid-cervical. So I'm going to turn my back away from you for a moment to show you what the hand placement is. But if you're working on your right side, my left side, right? If you're working on your right side, you're going to come across, right? And use your kind of a grip like this to hold. You're essentially going to stabilize the joint below and move the joint above. That's going to be your essential job. So if I turn away from you,
Moving you closer.
there you go.
Sorry,
So
do it again.
what happens is if I'm working on right rotation, okay, then I'm going to take my left arm and I'm going to come behind. I'm going to use this grip, okay, and just choose a level, right? It's a mid-cervical level. So you're pulling to the left and you're going to turn your head to the right.
Got it.
Right? You're pulling to the left and turning to the right. And I can say this to you because because you're PT, right? You're gripping the spinous processes and pulling them. Essentially, you're trying to pull them into left rotation. Hold on. I have to do my true right side for a minute because I'm confused. Even though I'm opposite you right now. Don't look at the screen. Oh, my goodness, that's the hardest part I find, is switching the right to the left so that the patient understands. All right, so if I'm going to, actually, if I want to promote right rotation, I'm going to have you block your spinous processes as you turn to the right.
Right.
And as you turn to the left. Okay.
Okay.
You're going to go in both directions. And you'll probably feel more tension as you turn to the left.
Yes.
Yeah. Okay. So you're essentially mobilizing yourself.
Okay.
So walk your fingers you're starting high mid-cervical, and you're going to walk your fingers down and see if there's a particular level where it's even out harder for you to do. So remember, you're going to turn your head to the right to sort of get your fingers oriented, and then you block and you're turning to the left. And it's as you turn to the left that you're doing that you're actually doing the mobilization. That's it. And when you find a particularly good spot, I want you to stay turned to the left.
Yeah, so probably top, more
More towards the top.
upper, yeah.
Okay, upper mid cervical. So kind of,
Yeah.
okay, good. Stay there. Right there is where I want you to nod yes. So your fingers are still pulling. Spine is processed to the left, which means your lower spine, below your fingers are pulling you into right rotation, and your cervical spine is in left rotation on top of it, right?
Got it.
Okay. And nod yes there. Good. Come back to neutral and keep your hand there for me if you don't mind. You okay with that?
Yeah.
Okay. And again, add that pressure in, and then just turning right to left to just move, just ease up a little bit. And then walk your fingers down just a little bit. And again, to the right to get your grip oriented, then shift to the left and take your nods. Maintain the pressure and turn into nose. Yep, back and forth so you ease up. That's the yes, back and forth to ease up. There you go. That's it. And take a little break. All right. Yeah, shake everything out. So now try and turn your head to the right. We better?
Feels a little better.
Here, sit sideways for me so I can see. Can you face, nope, other way. Sit the other way. There you go. And go ahead. Woo. Okay, that's a little better. You got a side tilt going on there. Okay, so come back forward. Let's go ahead and treat out your suboccipital.
Okay.
So, yeah. Yeah, as you nod forward, you're pressing forward. Good. Let's do that 4 or 5 times. Good.
Okay.
Good. And then take your right hand, and we're going to treat your suboccipital for right rotation. So, nope, hold on. Take a look at me for a sec. Take a look. Yeah, so this is where you're coming right under that bony part right behind your ear, and you're going to push into C1 as well.
Yeah, okay. Just start regular.
Yeah, just the regular. Yeah. And you're pushing left as you turn that head right. Yeah. Try and move your nose faster than your chin.
Okay.
Nope, that's your chin still faster than your nose. Move your, yeah. So I want your nose to get there. Yes, that's it. All right, stay right there. Stay right there. All right, and try and tip your head, tip your ear a little bit to the right. That's it. Turn there. That's the position I want. Good, in and out. So hold that side bend and then go into rotation.
Okay. So here.
No, hold, so you have here, so turn to the right. Turn to the right. Good,
Right.
do a little bit of side bend. To the right, to the right. That's
Okay.
it. Now hold that and add your rotation back in. Add your, yeah. There you go. That should be a little bit more precise
Okay.
in mobilizing C1. Two more, and then we'll check your rotation. Good. Take a break. All right. Sitting up nice and tall. Turn to me. A little better. Okay. Tip side. You gotta turn to me and do a little side bend to the right. A little side bend. That's what you're trying to get to. Okay. All right. Good. Okay. Now come back to neutral. Let me see that left hand come across. Yep, and you're kind of that pistol grip.
Yep.
around your spinous processes. You're going to turn to me to really get the grip. Good. Then you turn away and you're going to maintain that pressure. Turn away and nod yes. And then turn back to me. See if you can pick up this, go a little further and pick up the slack with your left arm, left hand. And then you took up some extra slack. Keep that pressure on as you turn away and nod yes. Good. Come back to me. Pick up any slack. And make sure you walk your way down to that junction between thoracic spine and cervical spine. So C7. Make sure you work your way down there.
Okay.
And then turn away and again nod. Good. All right, take a little break. Whew. All right, don't turn yet because I still want to see how we did.
Okay.
All right, and turn your head to me. Getting there. We probably gained about 10 degrees. So that's the work that we still have to do.
Okay.
Okay. For that mid cervical spine. So, but headaches, good that headaches are away. Good that your thoracic spine is moving better. Overall, I think just better fitness. The one thing that I want to make sure we do is looking at your hip flexor.
Okay.
Okay, so there are lots of ways to stretch hip flexors, but you've got some exercises that you're doing on the foam roller anyway. So yeah. One of my favorite ways to stretch a hip flexor is on the foam roller. So okay. Do you mind shifting the screen so I can see you on the floor with your foam roller?
Yep. Sure, you can see.
Yeah.
Where did I put it?
All right, so how I would recommend doing this is you're on your back, yep, but the foam roller is going to be underneath your knees.
Okay.
So you're lying flat, yeah, the foam roller is underneath your knees for a moment. And then you're going to... It's a very beautiful picture.
Yes.
There you go. Good. So go ahead and lie on your back.
Okay.
Good. And you're going to just pull that foam roller up underneath your tush. So you'll bridge up, pull that foam roller under your tush.
Good.
There you go. And just where it's comfortable. And then I want you to pull your right knee to your chest. So that foam roller may need to come up a little higher so you don't fall off. There you go.
Okay.
Yep. And then your right knee is pulling to the chest and it's the lever, right? And your left leg is just stretching out. You got your foot flexed. Don't bend that knee so much. Well, you can, but let's start with a straight leg and just let gravity work on that hip flexor. You feel a stretch in the front?
Yes.
Yeah. Okay. And then you can play with some mobility or some more dynamic motion by bending your knee and straightening it on the left. Yep. And then holding it straight and pointing and flexing your foot. All of that will change kind of the levers that are working on that hip flexor. And the other thing you can do circles. You can do little leg circles to try and where you're focused on the down stroke. Yeah, and then reverse your circle. Then you're focused on that.
Slogging through the mud.
Say again.
That's like slogging through the mud.
Yeah.
Okay.
But if you think, so I would do that on both sides. Okay. So I kind of use you can go ahead and sit up. As long as you understand that, yeah? You understand that?
Yeah.
Yeah, so I kind of use the knee flex and straighten and the foot pointing and flexing to sort of just hone in. And then when I'm comfortable, then I start those leg circles. And make sure you go in each direction because it is like slogging in the mud. But if you think about this, the hip flexor being so tight, right? So it pulls you this way, and then
Right.
your back starts to compensate back this way, and then your neck starts to compensate this way, and then you can see that you are right into your overall dysfunction. So
Right.
longer here, then that rests the forces, the extra stress through your low back, which then helps your thoracic spine move normally, and which then helps to resolve some of the stress in your cervical spine.
Got it.
So good. All right. The other complaint that you had when we first started was your foot, and I don't know what your time is like. We're at 8:26, but did you want to take a look at your foot?
I actually do have to go at 8:30, so
Okay.
we'll save that for another time.
That's
But
fine. That is not a problem. That's not a problem, but I'm happy to do that.